In order to understand the policies, financing, and structure of today's delivery system for mental health services and substance abuse services, it's really important to go back in time to understand how we've gotten where we are today. It may seem convoluted, but it's important to sort of understand what our key legislative landmarks have been. There have been a few, and some of the changes by others who have affected public policy. I'm not going to go back into the 19th century where probably the primary provider of mental health services were jails and asylums, although it's important to know we've sort of come back full circle in some ways in that regard. But I like to go back to 1946, and that's President Harry Truman who signed the National Mental Health Act. And for those of you who are thinking about research, it's important to know that that landmark legislation established the National Institute of Mental Health, and the first time that there was ever federal funding for research and education. You have to then really jump forward in terms of federal laws to the 1960s and Massachusetts' own John F. Kennedy, because it was President Kennedy who signed what really was the landmark legislation for community mental health, which was PL 94-163, which was the first federal funding to create community mental health centers and to create a system that primarily had been public hospitals. So this was landmark. For those of us who study mental health policy, this was the sign that we were going to move people out of large asylums, public asylums, provided by county or state governments, and move individuals into the community so that they could live successful lives. Now, just a little side note, while we refer to this as the Community Mental Health Centers Act, it was actually the Community Mental Health and Retardation Centers Act. And we all know that President Kennedy's commitment to this issue primarily stemmed from the fact that he had a family member who was mentally retarded, as well as probably had some mental health conditions, his sister Rosemary. And is often true when it comes to mental health policies and landmark legislation. Often family experience, even if the family doesn't talk about the experience, has driven some of these legislative markers. The Community Mental Health Centers Act, which was idealism at its best when it came to mental health policy, in fact, as we'll talk about later, actually is failed mental health policy, because the services that were created as a result of the Mental Health Centers Act never were really realized to meet the needs, the full range of needs of individuals with serious mental illnesses, the individuals who are in state hospitals who are meant to be able to be supported in the community. And I say that because in the mid to late 70s and into the 80s, we see individuals leaving state hospitals to the streets. And in fact, the homeless population of what we understand to be individuals who are homeless is because the services that were promised were never delivered. So in the late 1970s, two movements really started to come into being to help shape policy. And that was the anger of family members and individuals who were consumers who wanted something better for themselves than the streets and jails. So it was in 1979 that 5 women sat around a table in Ohio and created what we know now as the powerful National Alliance for Mental Illness. And in fact, I sit on the board of the National Alliance for Mental Illness. And at the same time, consumer groups started to form because they also believed that they were being stigmatized and blamed for their illnesses and not receiving the help that they needed in order to recover from their illnesses. So you have these sort of countervailing forces coming together. And so in the period of the 80s into the 90s, we see some limited federal, particularly at the federal level, reforms. But it's not until 1998 that the U.S. Surgeon General, Satcher, released the first ever Surgeon General's report on mental health, a report of the Surgeon General. And he describes the mental health system in crisis. In fact, if you read the entire report, he actually says, and something I agree with, that we do not have a system of mental health services in the United States, we have a series of component parts. And that will make sense to you as we talk further about sort of the current financing and structure of mental health services. There are two other major pieces of legislation. There's obviously lots of legislation we could be discussing, but the next significant piece in terms of financing of mental health services is not until 2008, and that is what I refer to as the Federal Mental Health Parity Act. And it's Senators Paul Wellstone and Senator Pete Domenici. You could not have two more disparate politicians, one liberal Democrat and one very conservative Republican. They come together out of a shared interest. They are family members. They both have families with serious mental health conditions, and they come together and believe that commercial insurance needs to provide a far better benefit for individuals. That really is a keystone marker around financing of mental health. And then we get to 2010, which is the mental health, and actually it's the healthcare civil rights legislation of this early century, and that is the Affordable Care Act. The Affordable Care Act takes the 2008 Mental Health Parity Act and really institutionalizes it in this huge omnibus law around coverage, access, and availability, and really tries very hard in legislation to integrate behavioral and physical health conditions. And that really summarizes where we are in terms of federal sort of blueprint for mental health coverages in the United States and sets a very different tone going forward.